The heart's job is to pump blood throughout the body to deliver oxygen and nutrients, but the heart muscle also needs its own blood supply to keep working. That blood travels through small vessels called coronary arteries. These are the arteries that feed the heart muscle. But if one of those coronary arteries already has plaque inside it, blood may not be able to get through properly. Plaque is a thick, sticky buildup made of fat, cholesterol, calcium, and other substances that slowly collect along the inner wall of the artery over many years. It clings to the wall and makes the opening narrower, so blood has less space to pass through. During very intense exercise, the heart is beating faster and pushing blood harder through an artery that is already narrowed. Under that strain, the plaque can crack open and tear the inner lining of the artery. The body reacts as if there has been an injury and quickly forms a blood clot to seal the area. But instead of fixing the problem, that clot can completely block an artery that was already dangerously narrow. Once that happens, part of the heart muscle is cut off from its blood supply. Without blood, it no longer gets the oxygen it needs, and the heart muscle cells begin to die. That is a heart attack. At that moment, the pain can be overwhelming. Many people describe it as a crushing pressure in the chest, as if something is squeezing the chest so hard they can barely breathe. The pain can be so severe that a person may collapse on the spot. To save the part of the heart muscle that is dying, doctors have to reopen the blocked artery as fast as possible. They do that by threading an extremely thin, soft tube called a catheter through a blood vessel in the wrist or the groin and guiding it all the way up to the heart. This catheter carries a tiny deflated balloon and a small metal mesh tube called a stent. Once the catheter reaches the blocked area, the doctor inflates the balloon. As the balloon expands, it forces the stent open and presses the clot and plaque flat against the wall of the artery, creating space in the center for blood to flow again. The strong metal frame of the stent stays in place to keep the artery open and prevent it from closing again. Then the balloon is removed, but the stent remains behind as a permanent support. Blood can then rush back into the heart muscle, oxygen returns to the tissue that was starving, and cells that were close to dying can still be saved. The faster that artery is opened, the more heart muscle can survive, which is why placing a stent quickly can make the difference between lasting damage and a much better recovery.